Ectopic pregnancy is an emergency situation. If you do not act fast, you might die. In this video, we are going to talk about the causes, what ectopic pregnancy actually is, and how to manage it, the risk factors. Who knows? You might be at risk, I might be at risk. If you want to find out more, please continue watching this video. This is Time with Dr. ADAMS.
Time with Dr. ADAMS.
Hi there, welcome to another episode of Time with Dr. ADAMS. In this video, we are going to talk about ectopic pregnancy. If you are new to my channel, my name is Dr. Saki. You can call me Dr. ADAMS. Naturally, when you get pregnant, this is what happens. The egg and the sperm meet and they travel all the way back into the uterus and it attaches itself to the walls of the uterus. However, in ectopic pregnancy, this doesn't happen. The egg and the sperm meet, however, they do not travel all the way back into the uterus. This fertilized egg attaches itself outside the uterus. It can happen in the fallopian tube, which is very, very common, somewhere on or around the ovaries, in the cervix, or even outside the uterus. And this is very, very dangerous. One may ask, who are those at risk of getting ectopic pregnancy? Someone who's ever had an ectopic pregnancy before is at risk. Someone who's inserted an IUD, an intrauterine device, is at risk. People who smoke, that is women who smoke, women who take alcohol, women who's had a woman who has had several abortions. When you have a couple of abortions, you can scar your uterus, so this can happen. A woman with multiple sexual partners. Now I say this because multiple sexual partners, you are at a higher or greater risk of getting sexually transmitted disease. Any woman who also has had PID before, pelvic inflammatory disease, is also at risk. So what are the symptoms of ectopic pregnancy? Asymptomatic. You can just be walking about freely, not knowing that something is happening in your body. Then as well, you can bleed, you can have lower abdominal pain, you can suddenly become very weak, very faint, dizzy, look very pale. Now this is when the ectopic pregnancy has ruptured in your body, and then you might have shoulder pain. Please, if you know you are pregnant and you start bleeding from your vagina, you start having lower abdominal pain, or any of these symptoms that I was talking about, rush to the hospital. Now, how do we diagnose ectopic pregnancy? One, you have to do a pregnancy test, a urine pregnancy test or a blood pregnancy test to make sure that you are pregnant. Two, we can check your hormone, pregnancy hormone that we call beta HCG, and then we'll do an ultrasound to know where the fertilized egg is. Now, this is where I cannot emphasize that. Go to A and C. Immediately you find out that you are pregnant. Immediately you do a home test and you find out that you are pregnant. Go to A and C. We'll do a scan to make sure that the fertilized egg is inside the uterus and not outside the uterus. Because so far as it's outside the uterus, it can rupture and it can kill you. It's very fast. Now, I've seen people die out of ectopic pregnancy. It's very scary and it happens very fast. If we find out early, we can save you. There's a medication, methotrexate, that we can give you that can absorb the fertilized egg back into the system, or even expel it through your menstrual blood. Then as well, if you do not find it early and you start having the symptoms, and you report to the hospital, we can take you to theater and take it out. Please do not joke with ectopic pregnancy. It is a very, very serious emergency case. If you have any questions or comments, please leave them in the comment section below and I will answer. Thank you for joining me. Please be kind to each other. Remember, still is